Hi, I'm Dr. Jeff Machat, Medical Director of Crystal Vision, Toronto, Canada, and I'm here in Japan, in Tokyo, visiting the Shinagawa Clinic, where they have done close to 10,000 KAMRA vision inlay procedures. And I'm standing here with Dr. Kevin Waltz, a longtime friend for almost 2 decades, one of the top refractive surgeons in the United States, based out of Indianapolis, Indiana, and one of the original FDA investigators for this vision correction procedure. Kevin, give me your thoughts. Talk to me about the patients. I mean, you've been around this technology for years, in fact.
Yes, I've been around it almost 6 years now.
Wow.
My practice has implanted a little bit over 100 patients. We've been following it for about 6 years. Patients do great. The nice thing about it is it delivers on its promise. The principles, the optical principles, are rock solid. The cornea does very well with it. It's minimally invasive. And you can combine it with LASIK, so if you're farsighted or nearsighted, you can fix that at the same time.
So in terms of this procedure, you know, if you had to pick one thing that makes it the most attractive presbyopia device, what would that be? What do patients really seem to get excited about?
Aside from the fact that it works, to me as a surgeon, the most important thing is safety. That I want to be able to do something for a patient and know I've got a very high degree of safety, just like getting in your car. Every time you get in your car, you take a small risk that something's going to happen. You expect the car to protect you if something does happen.
Right.
We've put in a lot of these implants, and every once in a while something does happen. And everybody that something bad happened to sees great today. I've never had a procedure where the worst outcome so far is we had to take it out and just kind of start over. That's an amazing safety profile.
Well, obviously that comforts me. As you know, I'm having it done in the next 48 hours, so I'm wildly excited about it. I just absolutely, for me, you know, reversibility is a huge safety factor, but the ability for me to see well far away and preserve that while still improving my near vision, it just, that really does it for me.
And don't forget your intermediate. Most presbyopia correcting devices, they give you really good distance and really good near. This one gives you a whole range of things because of the way it works optically. So people talk about distance and near,
right.
But one of the strongest pieces of that is your computer and your the dials on your car. Those distances work really well with this technology.
And that's exciting because that technology, that device will work not just today, but 10 years from today, and it doesn't diminish in terms of the strength. So you've been following patients for 6 years, and you know, is it as rock steady in terms of their ability to read over time?
Oh yeah. And we've added to a couple of cataract surgeries because the people that need this are a little bit older when we put it in.
Right.
And so over 6 years' time, you'd expect a few people to get cataracts. What's amazing is it works even better after the cataract surgery. So I'm not aware of any other technology where the patients routinely report that their vision actually got better distance and near as a part of the cataract surgery, and we didn't have to change a thing.
That's amazing. So this is a procedure that will work in people who've had LASIK in the past, people who've had cataract surgery in the past, and people who just are simply interested in having LASIK today for getting rid of their glasses, but still want to have capability of reading up close, not just having clear vision in the distance.
And you can have this procedure in your 40s, confidently knowing that one day when you're in your 70s, you have cataract surgery, no big deal, still going to work.
Wow, that's exciting and wildly comforting, considering that you've been, you know, looking and dealing with this procedure as one of the key investigators for 6 years for a prospective patient who is going to be having it done.
Yeah, but you're going to be young forever.
Thank you, Kevin.